encompasses psychoeducational assessments, as well as custody assessments for families undergoing divorce proceedings in a family court. She has a strong interest in supporting children to achieve their full potential, and her comprehension of the school system in Hong Kong has been further through the education of her 4 children here. Well done, Dr. Cook. And on the screen is Dr. Kristie Craigen. She is now in Gold Coast. And Dr. Craigen held management position for almost 2 decades and is a psychometric testing and program development specialist with almost 15 years assessment experience in clinical, educational, and organizational contexts. Dr. Craigen now focuses on the assessment and evaluation of children and adolescents who are experiencing behavioral, emotional, and academic difficulties. And on my right is our Mr. Dennis Ho. And Dennis has been a lawyer for over 30 years, and she has experience in all sorts of family law cases. Dennis is the chairman of the Family Law Committee of the Law Society of Hong Kong, and he is also the non-official member of the Commission on Children of Hong Kong. So, very welcome, all the speakers. Thank you so much to contribute in this webinar. So, with the relaxation of the social distancing rules from of the Hong Kong government, it seems that it's a great relief for all of us because we've now got a chance to not wear our masks outside, to have more social gatherings, and then the schools are reopened. But unfortunately, just I think few days ago, when the school resumes, there are 2 students just fell off the building. They committed suicide. And I think it's very sad. And it also seems that there is a huge impact on the psychological well-being of our children. So I really want to explore this today, and maybe with Dennis sharing his experience on how you see the growth of divorce in Hong Kong during the COVID, and what special cases that you feel that really hit your heart when you are dealing with cases in the past 5 waves of COVID.
Yeah, thank you, Rita. It's always very sad to hear a story just mentioned by Rita. And I mean, no doubt, I mean, these 2 children are normal kids. Think about, I mean, the tremendous stress they have, I mean, for most of the students and when they're studying. And if it comes to the special needs children, I mean, surely they have more stress. I mean, the stress is not just for the children, it's also for the parents who are caring for them. And it is not an easy task at all. During the COVID, I mean, special needs children certainly have a lot of encounters of difficulties and stress, and parents too. I mean, Rita just mentioned about that. I mean, now we have less restriction on wearing masks. I remember seeing in the TV, there is a case where the parents have 2 special needs children, and one of the eldest son refuses to wear masks all the time. I mean, whenever they go out, the child just refuses to get out to put on his mask. I mean, think about that. I mean, the parents can't do anything. I mean, the only way she mentioned that she just kind of give up. And there are many people look at the child, I mean, thinking why he's not wearing masks or things like that. Now, so far as the divorce situation is concerned, surprisingly, I mean, according to the judiciary sort of statistic, there aren't so many divorce cases come up during the COVID time. And one can imagine is the reason behind it is basically there is, I mean, the court proceeding has all been stopped for a while, sometimes for a month or sometimes for 2 months. And making filing of a new petition is difficult. So there is one of the reasons. The other reason is many parents, I mean, from my own experience, They said that, well, I want to get a divorce, but not at this time when we have faced with other so much, issues within the family. They want to deal with it after the COVID. And, and then some parents argue about whether they should divorce in Hong Kong or they should leave Hong Kong and go somewhere else so that they will get the divorce somewhere else. So it all contributes to the divorce rate is rather contrary to the general views, thinking that divorce rate is going up, but it's in fact it's come down a little bit. But one thing is for sure, there are more cases of domestic violence, within home. Now, one can imagine that. I mean, a family of 3 or 4 or even more, they all stay in one house. For some family, even for smaller place at home. I mean, they used to. I mean, both parents may not seeing each other for the whole day, and now they not only seeing each other, but they have to face with the, to become a teacher, helping the children to do, a Zoom class and things like that. It's not an easy thing. And for this situation, for those special needs, it's even worse. I mean, special needs are not able to sit still for so long, looking at the screen, maybe just an iPad or maybe just a small computer. It's difficult for parents to control them. I mean, if they have a chance to go to school, to have all the other activities, not just, learning from the books or from the usual stuff. They have more time to, to have other exercise, socializing with other people, going out in the playground and things like that. So for special needs children at home for a long time, it's definitely not easy things to do. Yeah.
Thank you, Dennis. Actually, I think there are a lot of media coverage to suggest that there are increase in divorce rates, and only until we've got the statistics from judiciary that we realize that actually there's no increase, but actually is a drop in the divorce numbers last year. But it has created a lot of tension at home, as what Dennis has just said. And very often during the arguments, the parents are thinking about themselves because they really want to put their arguments forward, and sometimes ignore the feeling of the children, especially during if there is a marital dispute, and the children might then be used as a tool to communicate between the parents. They are often asked to express themselves, make a decision for themselves, and even be the conduit between the parents. So I think from my perspective, I believe that the children in the past few years have suffered a lot, but I don't think people really care about them. So Dr. Cook and Dr. Craigen, what are your views about that? While divorce rate is reducing, have you been receiving a lot more inquiries because they are all stuck in the household?
Well, I guess that's the thing. As you said, we could be looking at the divorce rates increasing, or we could be actually looking at the amount of conflict increasing within the home. We know certainly our business slowed down very much so over COVID because the courts were closed, and when you've got parents losing jobs and a lot of risk to do with financial security, the last thing they want. But that high conflict, and just like when you have a high conflict divorce, we all know that it really isn't the divorce that it leads to psychological difficulties or mental health problems in kids. It's actually the conflict itself between parents. So we really want to start moving towards divorcing well. And how do we divorce well? We want to keep reducing children's levels of helplessness. And we also want to kind of reduce the loyalty binds. Usually, as you mentioned, Rita, children are often put in the middle, and, parents are acting out all their frustrations and bringing the children into those arguments. So we also want to reduce the frequency. And if we're in lockdown and we're stuck in a, often small home in Hong Kong, that, of course, is going to put the levels of conflict up. So, as social distancing measures, we less stringent, then we can start to get out more and reduce those conflicts. Yeah, and we also want to work at reducing, emotional insecurity in children and stabilizing their emotional lives. So that's all been really difficult to do in the situation that we've been faced with in COVID across the globe over the last couple of years.
And Dr. Cook?
Yeah, and I think Kristie's hit on it. I think we moving forwards now, we want to make sure that when families do divorce, that they mitigate, they reduce as far as possible the impact on the children. And in planning for that, as Kristie highlighted, the good divorce, if the parents are co-parenting well, communicating well, and implementing plans right from the outset to best serve the interests of the children, so that the children then sort of know what's going to happen. They don't feel sort of so much aligned with one parent rather than the other. And that very much reduces the long-term impacts on the child going through a divorce.
And I think the term of co-parenting is often being reminded in court and amongst the solicitors and psychologists. But I guess the parents who are in dispute, they don't really understand that. Maybe Dr. Craigen and Dr. Cook, can you give parents some tips how to really co-parent with each other during this?
Yeah, well, I guess first and foremost, we'd probably recommend strongly getting an assessment so that we can understand the dynamics going on within the family and the strengths and weaknesses. I worked in the care system in the UK, and oftentimes it would be, neglect or abuse. In Hong Kong, it's more between the parents from what we deal with in our private practice. So really getting a parenting plan that draws on the strengths of each parent. And if you have an independent third party working with you to set out all the criteria of and all the job duties that you're going to do within your parenting role and agree on those up front. So we do a lot of child inclusive mediation cases as well, where we go in and help create these parenting plans, get parents on the same page from the outset, because once it's all written down, they can't say, oh, well, I didn't know that. And we even break it down into how they're going to communicate, by what channel, on what days, how does it all look like their parenting, who's going to pay for what. So just having a really good parenting plan in place will help you effectively co-parent.
Okay. That's very useful. But I think in divorce cases, the trust level between the parents are very low, even though they might be able to, with your help, implement a plan. But they don't trust each other. They actually, with the litigation behind, they always find fault of the others. So maybe.
Well, I mean, Kristie's and Alison's mentioned about a good divorce. Well, it is. I'm so glad to say that most of the divorces are good divorces. Only a small percentage of divorce cases are high conflict divorce cases, which cause lots of trouble. Now, this also applies to divorce cases where special needs children are involved. Most of the divorce in a family where there is special needs children, they are still good divorce. Now, good in the sense that I would say that one parent simply walk away, don't care about it anymore, okay? And high conflict situation also happens in a divorce with special needs children, okay? Now, let's go back to the general cases when they walk away. The issue here is normally when, think about it, when parents faced with a child or even two children are all special needs children. They can't cope it unless they have sufficient sort of resources to help them, and they manage to find the right way to approach other sort of institutions or professional for help. Otherwise, I mean, the parents can't really deal with children in special needs. Okay, they're so frustrated. Either the mother or the father just simply walk away and don't want to hear or care anymore. Not about money, okay? They just walk away. So, I mean, in that sense, maybe a good divorce. But the problem still comes when it's come to the issues of money, okay? There are divorce cases where special needs children involved. I mean, when one parent is looking after a child, I mean, he or she, that parent, may not have the financial ability to sustain daily life. So it very much has to rely on the other parents who walk away. If that parent is good enough, continues to pay maintenance, that's fine. But one thing from my experience is that, think about a situation. Normally, the court order mentioned that a child maintenance will be given to him until he becomes 18 years of age or complete full-time education. Okay? Most of the special needs children can't go to college. So they finish when they're in secondary. Luckily, some of them manage to go to the college, but that will only retain them for another 3 years or 4 years. But what happened? I mean, they simply don't have the ability to work. You still have to rely on the maintenance from the other parents who has more financial resources. Then under the court order say, no, you finish your maintenance from the other parents when you become 18 or finish full-time education. So once they leave school or become 18, the maintenance can be stopped. Now, I am aware there are cases and people have make inquiry with me that what to do. It's not an easy thing. The law also provides that, well, in certain circumstances, we can go back to court to ask for maintenance to continue. But unluckily, so far as I know, I can't find any cases because several cases which I come across, in a way, it's good for them. They manage to settle. The provider continue and agrees to continue to pay, knowing the difficulties the child or the other parent, the caring parent is look after them. So that's fine, okay? But some think about if some being nasty or very unhelpful or even disappear, there will be a big problem for the carer, okay, and for the child. So this is something that is, we need to deal with in future for special needs, adult special needs child, okay? Now, the other sort of other thing is that there is issue about even the parents are divorced. There are cases that the parents disagreed on how to bring up the child. In what way? I mean, they have different opinion. That's why they separate. That's why they want a divorce. And then they have a lot of arguments on which school to go to, whether go to international school with special help or go to a local school or even to relocate to another country where more supporting services are available for special needs. There are lots of arguments with this. Okay, this is a matter to going back to court. Now, one of the cases which I have been dealing with is that a parent who'd been relocated back to his own home country, and then the other parents with a special needs child in Hong Kong, they have a court order of joint custody, and one parent's got care and control of that special needs child, and the special needs child's disability is can't really work or even write or speak properly, He managed to walk. I mean, that's a good thing, and to look after himself to a certain extent, but he just simply can't learn anything. Okay, he is all sorts of disabilities around him, and the issue is that although both parents got joint custody, the overseas parent always wants to know how the child is getting on. And he wrote to the school and asked the school, can I have the report? Or can I have some updates on my child? What happened was the school simply rejected. Sorry, you are not the guardians. Okay? Now, think about it. Legally speaking, I mean, both parents got joint custody. Legally, arguably, we say that both parties has guardianship of the child. Now, no, I mean, normally the overseas parents do not know how to deal with it. Now, the other thing is that what happened was, and then when the overseas parent get a lawyer to write to the school and say that no, you are wrong, you should give that parent, he got joint custody right, that this is under the court order, and he's entitled to all sorts of information about the school. And then the school come back with a very long legal letter saying that, I mean, sorry, what you are looking for, school reports and, in updates of his situation, these are all routine thing. This is a matter for the parents who get care and control of the child. And you, the overseas parent, is not the parent who has care and control. It's only the local parent who has care and control, daily care of the child. That's one thing the school rejected it. And then he continued, the school said that, well, the school is independent. We're not part of your party in your divorce disputes. We don't care. And then the other thing is that, and after all, the school is not a party in your divorce proceeding. We don't have to follow your court order. That's ridiculous in a sense. And the final thing is that they use this, sorry, personal data, we can't give you anything anyway. So the father have no way, the overseas parents have no way to find any information about his child. Obviously, the local parent refused to give anything to the child, to the overseas parents. So it's kind of very frustrating, even if a parents of a specialist want to be involved in the child's life or give some ideas or how to, to support that child. I mean, once the local parent reject the other parent, it's difficult to have what we call co-parenting. So it's a lot of problem that legally we have to resolve it as well.
It's really good points there, Dennis. I think it's nice to be reminded that people do divorce well because, in our clinical practice, we tend not to see those cases. So it is, you're right, that a huge majority of them do divorce well. But I guess in going back to Rita's question, what changes are we seeing? We are seeing a lot more relocation cases, aren't we, Alison, with, one parent wanting to leave Hong Kong for various reasons and, the other parent wanting them to stay. And, I guess that's where, to answer the question when it comes back to co-parenting, how can we increase those lines of communication? It's, about doing the right thing by the child and not withholding information, I guess. So, it must be extremely frustrating for parents that are possibly living on the other side of the world and can't get that information, about their child, especially if their child has special needs.
Thank you, Kristie. And the reference of special needs children have been mentioned a lot in the past 30 minutes. So maybe we give it a bit of explanation. Alison, what are special needs children?
Well, in the sort of broadest context and in relation to schools, SEN or special education needs children refer to any particular educational requirements the child needs in order to achieve what they're capable of due to their learning differences, physical disabilities, medical conditions, or emotional or behavioural challenges that impact their ability to progress with their education.
Okay, so perhaps I will now take you all to a PowerPoint with some facts. Instead of you listening to me, you can look at the slides here. From the government record, you can see that actually 94% of our children are ordinary children. And 5% of the children are having certain disabilities other than the intellectual, and 1% actually have intellectual disability, which is about 5,200 children in Hong Kong under 15. We haven't mentioned anyone over 15, or they are actually over 18. And those over 18 are, I believe, is the group that mostly being forgotten, because there is no, as Dennis said, there is no maintenance order for them. And I don't really see any real legislation or provision to cater for their needs. So of this 1% children with intellectual disability, about 4,500 children are actually residing with their parents in the households. And then the rest go to the institutional residents. And while we've just talked about giving certain definitions of special needs, these are the most common disabilities of the children in Hong Kong. ADHD, which we've often heard, 22,800. You can see that these numbers actually they do not match with the number of the previous slides, just because there are children with more than one disabilities. So you can see there are difference in the number. So specific learning difficulties is the next, 17,000. Autism, which we've often heard, 11,000. Mental illness and communication difficulty, 2,500. So we've seen the number of these children, and then we've always talked about assessment. How do they assess, and do they need to be assessed? I'm not talking about the private practice. I'll leave it for Kristie and Alison to talk about that. But from what we know from the government, you can see that age between 0 to 6 years old, we have the general maternal and child care health centers, which monitor the growth of the children. And when the children are at primary 1, they will be assessed by the teachers. Well, firstly, I don't know how qualified they are. I remember from my personal experience, my son, when he was in primary 1, and you know, sons are always a bit naughty. So, and the teachers, because he might not be able to sit down and properly and listen quietly. And then the teachers at the parents' meeting told me, well, I think you need to get your son assessed. So I think for especially for local school teachers, they easily put a label on a child. So it might have an impact on their development. So I'll leave it for you, Kristie and Alison, to talk about that. And under 12 years old, and they can consult registered doctors or psychologists to provide a comprehensive assessment. And according to the government, all newly referred cases will be seen within 3 weeks after registration. I don't know how accurate it is, but if they can be seen in 3 weeks, I think it's quite amazing.
Yeah.
Yeah, and so the support to special needs children, and actually in the public school, only about 10% will provide support for special needs children. And as I said just now, they are often being labeled, and some of the teachers might simply ask your child, maybe the school is not suitable for you, you might have to find somewhere else. So this is the problem in Hong Kong. And then the special education services available in Hong Kong, well, obviously it will be from the Social Welfare Department, which provides the special preschool training to children. And the schools themselves, there are 62 special education schools, 8,290 students are enrolled in those special education schools. And there are also a small number of non-public sector ordinary schools. Then hospital authority, they will arrange appropriate treatment and follow-up. But from what I've heard, this follow-up treatment is often very slow. And like our court cases in Hong Kong, you often find a very long queue for services to be provided. And then again, the Social Welfare Department to provide rehabilitation services for preschool children. And as I also understand, those over 18, I'm not sure if there is such services for them. So we also need to think about that. The community organizations, so they have created something other than those provided by the government. So where can I find support resources for parents with special needs children? telephone inquiry for those government organizations, social workers. And there are also a lot of self-help groups, which you can find from Facebook or some social media, like Hong Kong Association for Specific Learning Disabilities, Rehabilitation Alliance Hong Kong, and Special Needs Network Hong Kong. So you can find the parents with similar situation. You can share your experience there, and you can find the support there. Community organizations providing supporting special needs children, you can all find all this information. Okay, these are the facts, but then we don't want to just, how do I stop sharing? Escape, I remember. Okay. Sorry, whenever I need to share my screen, I'm nervous. Okay. So now we've gone through all the hard facts. Kristie and Alison, do you think the services provided so far by the government or by the society, they are sufficient for special needs children?
Well, I think just from our perspective, it was really interesting hearing what you had to say, Rita, about, there's only about 10% of children in the local school system, their special needs are supported and capacity for that. What we're tending to see is that everyone thinks that the international schools are populated by expats, but there is a growing trend that of almost, the 40,000 kids in international schools. A lot of them are local Chinese or Chinese from the mainland, and they're the ones that are coming down that may have those extra additional needs like ADHD or a specific learning disorder, because the international schools cater a little bit more. They can diversify their learning and cater to people at all ends of the bell curve. So we're kind of really seeing, I know that, a lot of the international schools have a quota where it's got to be 85 or 90%, foreign passport holders. But we're really seeing that shift in a lot of local kids coming over to the international school stream. Do you agree, Alison?
Yes, and I also think you hit on numbers earlier, but that there's also, I think, quite a long waiting list for these children with special needs to get into the facilities that can best support them. We had a child recently that we assessed because they needed the assessment to get on the waiting list, but in the end got so disappointed with the wait that they ended up relocating. But I think, we have this number of places, but I think the need is far greater.
Oh, yeah. But I'm just thinking, not everyone can afford the international system. So for those local kids who cannot afford international curriculum, how parents can cope with this and how they can communicate with the school so that their child's needs will be taken care of?
Yeah, it's really difficult, isn't it? I mean, Alison and I, in preparation for this meeting, we were really trying to think and break it down into what is it, because the needs of children vary so greatly depending on their presenting conditions, their personality trait. But basically, fundamentally, what can we do to help our children feel better? And there's self-determination theory that talks a lot about autonomy, competence and relatedness, the three pillars of emotional health. So if we can help children start to have more say in choosing their own path, if we can make sure that they're competent and successfully skilled in that area to follow their own path, and then they also have the support that they need. So the support may not come from the school, without saying anything bad about the local system. I'm sure there's a lot of positives, but as you mentioned, there's not a lot of scope for differentiating the curriculum. It kind of is what it is. So maybe they can give that support in other ways. Back end. I really know that because we have online services now, there's a lot of tutoring services out there. The last thing I want to say is tutor your kids more. Often in the local system, they've got enough work to do, they're working late, but there are avenues that we can afford supplementary services, pivotal supplementary services for very low cost. Professionals in Hong Kong tend to be quite expensive, but the online options, for example, I have a math tutor for my son that's sitting in Zimbabwe, and she's $11 an hour, and she's got a PhD in mathematics. So it's getting creative in thinking around the solutions that we can provide, and I think online services for things that are the higher order, when I'm talking about learning differences like ADHD or, dyslexia, dysgraphia, not the more severe disorders like on the autism spectrum.
Okay, thank you. So then how about, we've just talked about the education, but there was a saying that, let me read it. Mothers of adolescents and adults with autism had levels of stress hormones comparable to soldiers in combat. Is it right, Kristie, Alison?
I think it is extremely stressful being responsible and raising children with special educational needs or any special needs. And I think what we mustn't forget is that there's that reciprocal relationship between how the parent's mental well-being and the child's adjustment. Now, many of these children don't sleep at night. For example, kids on the autism spectrum, it's an inherent part of the nature of the ASD is that the child generally has disturbed sleep. And as parents, we know from when our children were babies how that just affects your whole ability to function. If you're sleep deprived, then little things get big things. So I think we've got to support the parents' well-being, their emotional well-being, because if they're feeling better about themselves and about the situation and being more in control, the child will pick up on that and their adjustment will be better, their behavioural challenges will be better. So it's not just supporting the children that we need to be looking at, we need to be supporting the parents. And as you said, with your data about the stress hormone level, it's very stressful. I mean, being a parent of a neurotypical child has its ups and downs and stressful moments, but you've got that sort of 24/7 when you're responsible for a child with special needs.
Yeah, Alison, can I ask you a question? So, well, where do these parents of special needs get help?
That's a fantastic question, Dennis.
Yes.
I think it depends a lot on their financial resources. Counselling services can be helpful but expensive. I think Rita mentioned earlier about the going on Facebook and online support groups. There are lots of parent focus groups within, that Hong Kong is quite well placed for those.
Yes.
And I think it's very helpful to know that the feelings that you have as a parent of a special needs child, you're not alone, and by sharing your experiences with someone else that's having the same struggles can help to ameliorate those somewhat.
Okay, yeah, apart from getting counselling or help online or things like that, what would you recommend these parents to do in order to help themselves? I mean, what sort of things they should do?
Self-care, yeah, self-care, Dennis, is very important. I mean, if they just have some periods of respite where they can get out and go for a run, if they can go and have a coffee with a friend, just sort of a walk in the country park where they're surrounded by green and tranquil and time for them just to refocus and just have some me time, so that then they're sort of more emotionally able to cope with the challenges when they get back home.
Yeah. Well, the other question which I want to ask is really, in a way, when parents find their child is a bit strange or have complaints from the school, just what Rita mentioned, I mean, would you recommend the parents to get the child assessed? I mean, parents always worries about their child being labeled as special needs. Now, it's how we going to overcome this sort of wrong idea of being labeled. I mean, obviously, I mean, this modern world is more easily accepted, but still, a lot of parents, when they face with the problem, they don't want their children being assessed and being labeled. I mean, what would you recommend to do?
Well, I think you're absolutely right, Dennis. There still is stigma.
Yeah.
I think there's also some not full understanding, as Rita mentioned, with her son, with various developmental stages of children. You know, being overly active at 5 in a boy is not unusual. But I think if we can try and get across that an assessment actually helps understanding that child, and it might not be in a negative way, it can be used in a positive way to find out what that child's strengths are and use that in supporting them and overcoming the challenges that they're facing. So it's not necessarily going to have a negative outcome, having one's child assessed. It can be very informative, and in fact, you know, admittedly we're in private practice, but we often assess children for whom the parents that don't have any concerns, but they just want to do it to make sure that they're not missing out on anything, and to find out how best to help their child grow and how to capitalize on their strengths.
So would you recommend if there is any sort of sign or the child needs help, would you recommend the parents to get the child assessed as early as possible?
That's the key, early, because if there is a major issue, or then the earlier the intervention starts, the better the outcome for the child.
Yeah,
No
so
matter-
that the child
no matter what it is,
can get help.
Yeah. The support service, the earlier those support services are provided, the better the outcome for the child. Yeah.
For those children with mild sort of special needs, with those early assessment and then getting early help, whether it's kind of visual therapies or speech therapies, would you see that child have more chance of, you know, going back to the mainstream or things like that?
Absolutely, yeah, absolutely, it's key.
Yeah. Good.
And Kristie, do you have anything to add?
Well, I was just thinking about how this relates to divorce and, you know, relocation and that sort of thing. And, you know, I really think that it's really good to highlight that it's not a one-size-fits-all approach. And, you know, the assessment will tell us how to best move forward for that particular family and that particular child. You know, we know some families that would really benefit from the services because of financial constraints and, you know, going back to Australia or the UK where they can get free services. We know other families that benefit from staying in Hong Kong. They've got a better social network. You know, they've got more families around, more of their family around them. They have, because they have older children with, or, you know, at young adult children with profound special needs, they have access to helpers who can actually help with their daily care and give them some of that respite. So it's really important to take each case as it comes, as its own unique, you know, special case with its own strengths and weaknesses that we need to understand to act in the children's best interest.
Yeah, I totally agree with you, but I think under general circumstances, it will be easier to achieve. But in a high conflict divorce case, it is really difficult. And parents, because of their arguments, they prefer the judge to make decisions for their children instead of themselves. And I think it's very sad because the judge actually does not know your children, does not know your needs. And you end up spending a lot of time and money to fight in court based on certain reports, like the social welfare report from the government. It might not be comprehensive. So I really hope that parents can take the destiny of your children in your own hands, and then to try how to co-parent with each other to get the best solution for your children. I think this is very important.
Indeed, and then Kristie mentioned earlier on, it's always good for parents to sort of go to mediation, to have you know, to get both parents to understand the situation. It's better for them to work together rather than fighting against each other. And getting a child, I mean, not just simply assessing their abilities. It's always this, not just special needs. And even for any normal child whose parents are going through the divorce, this child has to go through assessment by social welfare department, assessment by psychologists or psychiatrists, or even more professional people to get help. And money has to be spent, and the child has to be stressed for a long period of time. Normally, these sort of custody issues, fighting in court can easily last for a few years, and it is not advisable for them to do so. Totally not good for the children.
Yeah. We have 11 minutes left, so we will be opening up for Q&A. But before any questions come, I have a key question, because we are divorce lawyers, so we are dealing with high conflict cases. So there are often arguments between the parents in divorce case. Firstly, should the children be assessed? And after it's been assessed, whether they should receive ongoing counseling or treatments, and how often they should have this treatment. Do you have any statistics or any observations about this? I know each case is different, but
you know what, we often laugh to ourselves good-naturedly, because we often feel like it's the parents that probably need support services more than the children, so that they can stop fighting.
Yeah.
But understandably we see that, the impact divorce has on, it's the conflict that has on children. And, we kind of see with the younger children, it disturbs their ability to attach, so it leads to, relationship issues down the track and a lack of trust.
We've lost Kristie. Yeah.
And so we get to see these other outcomes, where they're more isolated, they're more withdrawn, they're taking bigger risks because they want to push into that adult stage quicker than what they should, with, the slowly backing away from their parents. They're kind of forced down that track. So it's, again, really, really hard. I know there's always a lot of contention around, one parent wants them to see someone and the other. But if you understand that the dynamic is often, some parents like to use that to kind of show that the kids need this support and shouldn't see the other parent, when actually it's quite the opposite. The children are kind of doing quite well, and all that what they really need is reunification therapy to get their other parent back in their life, and really missing out on, the social capital that comes with having two parents.
And while we are waiting for questions, and I have one more. I think it's quite typical for some of the parents with special needs. They think that they should have another child to help taking care of the one with special needs. So what's your view on this?
Yeah, and again, there's no one size fits all, and I think it depends very much on what the needs of the special needs child are. Because if it's something that's heritable, then you've got to be mindful that if you have another child, they may also have special needs. If it's something that's not anything to do with genetics, then yes, it's a different case. So always get advice, seek professional advice from somebody who's an expert in genetics and how heritable a disorder might be.
But what's the psychological impact of the sibling?
Well, again, being a sibling of special needs child has its own complications. It's a lot of responsibility, because oftentimes they're going to be the guardian when the parents are deceased, and it's not easy growing up as a neurotypical child when you've got atypical siblings.
Yeah, that's brought up the questions where special needs children become older, and the parents become aging, and there's always worries about their future, their own special needs children's future. So parents should plan about that, isn't it? Whether be it there for the care or for the financial support or things like that.
It's true. And then the financial support for the special needs parent, I think this will be covered in our next webinar, and
Yeah.
I will give you the details. But in the meantime, we have a question from the floor. What are your views about family therapy for divorced parents and their children? At a family therapy clinic, there seems to be more court recommendation for family therapy over the years so that co-parenting issues may be worked on.
Yeah, it's really, I know in private practice, you've got to really look at what you're getting if you're going to family therapy. You need to check that this therapist is appropriately qualified. The fact that a lot of therapists, I mean, we're just moving towards mandatory registration in Hong Kong for psychologists and mental health professionals. There's a lot of people out there that say they can do something and they fall very short. When we have high conflict divorce and we have estrangement, it's a whole different set of therapy to what usually we do with unconditional positive regard. So first and foremost, make sure this person is a specialist in this area. If you see that they've got 15 different specialities all the way from addiction, through to children and adolescents and, can do sign language, let's just keep it to a couple of specializations so we know that their knowledge is deep and broad. And, the other thing is that, the type of therapy, we have some parents that just are never going to be able to sit in the same room as each other. And that's okay. Some parents want to move on. But how do we help them co-parent? That's a different kind of therapy altogether. And helping them co-parent in a way that doesn't undermine the relationship the child has with either parent. So they're the set of skills that we can focus on rather than mum and dad, becoming best friends, because, sometimes that is just never going to happen.
But given the different dynamic in the family, how do one find the right therapist?
Yeah, and usually they won't agree on one either, will they?
Exactly.
So that's why it needs to be court mandated. There are a number of really good professionals in Hong Kong, but there are a number that just wouldn't be a good fit. And again, I feel like if you have a full assessment, then that person could probably recommend follow-on services that will fit. Because when we do the assessment, we're not just looking at the child's needs either. We're looking at the parenting skills and the psychological dynamics going on between the family. So then we can start to see where the problem issues lie and how we can use strengths to overcome weaknesses. So a full assessment, again, is what we recommend.
Perhaps let me say something about this as well. So far as the legal proceeding is concerned, if a judge order, the parents and even the child to go for family therapies, normally the judge will call for a report every 6 months progress report. So if the treatment is helpful, the court will, in the end, will say that there is no more progress reports to be need in future. So it's really depends a lot on how the parents and the child manage in the family therapies. If they have been receptive to the treatment, parents always in those situations are more getting to understand each other better. And when all the other issues in the divorce proceeding, like the financial issues, and the main suit of the arguments about whether whose fault in causing the breakdown of the marriage, all these issues are sort of clear. And during these family therapies, it's always help parents to start to look at the matters afresh in a different sort of perspective, and they are more receptive to the family therapies, and it helps.
I have seen some cases where some family therapists refuse to engage or work with a family that are undergoing or going through litigation. So as long as you're not going into court, that's one of the, criteria for the family therapist to see you. So again, that can sometimes be hard if you're already in a high conflict divorce, because some therapists won't work with you in that case.
Rightly said. It's normally from my experience that I've seen some parents when they're in high conflict, they just simply make all sorts of excuses of not attending the family therapies. So it all depends on how the other parents, take the issue. Sometimes the other parents will, go to court and cite for the other parents for contempt for not following the order. So it's in a way that's prolong the conflict between the parents. But to make the other parent understand that they should do something like this, and it really needs to take a lot of effort in the divorce proceeding, particularly when there is a situation where, well, sometimes we shouldn't use the word parental alienation, when one parent is being sort of not favored by the child because of all sorts of reasons. The issue with getting the treatment from family therapists is even more harder, as you said, Kristie. I agree entirely with you. I have in my hand, several cases which still going on dealing with these sorts of issues. Yeah.
Yeah.
It seems there is another question which
I think
we raised.
Yeah, I think it was.
Do you have anything to add, Alison? Should parents consider giving birth to another child?
Yeah, it's a very big decision, and as we said before, you've got to think about the heritability, whether you're likely to have another special needs child, the implications on the special needs child, and as this attendee says, that they require more energy and resources than a neurotypical child.
Yeah.
Okay. Thank you very much. Kristie, Alison, and Dennis. And we've got a very informative session today. And for this webinar, we have recorded and we'll put it on our website if anyone wants to look at it again later or pass it to your friends who have special needs. And as we said, we are running a campaign to take care of the needs of the special needs parents. So I think we'll have this next session to talk about the financial options for those parents. So just watch out, and then we'll provide the details later. So thank you very much. And then also thank you for those who joined our webinar. Have a long weekend. Thank you.
Thank you for having us. Bye.
Bye-bye.